Good morning. Welcome to Financially Speaking. I'm your host, Drexwell Seymour. It's such a pleasure to be here today. Of course, today is my wife's birthday, so happy birthday to Joanna. Oh, by the way, today is a public holiday. It's Joanna Seymour Day. No, I'm just kidding. Y'all stay at work. Stay at work. But anyway, today we have two young ladies from the National Health Insurance Board, and I think it's very important that we bring awareness about the National Health. I personally think that the National Health is such a generous program here in the Turks and Caicos Islands. And sometimes, we take that for granted. There are so many benefits that we enjoy. I know some people complain about sometimes maybe waiting for referrals, but there are so many benefits. I think we are one of the few countries that we can say that we enjoy what we are getting from our health system here in Turks and Caicos. And with that said, I want to welcome these two young ladies. I'll have them introduce themselves and let them tell you who they are and their positions at the National Health Insurance Board. With that said, I want to welcome both of you to the Financially Speaking show. Thanks for coming. Appreciate that.
Thank you for
Introduce
having
yourselves.
us. My name is Judy Dean. I am the customer service supervisor at the National Health Insurance Board. I just want to say thank you for awarding us the opportunity to
Absolutely.
appear on this show today to bring some awareness to our community
Yeah.
on the behalf of the National Health Insurance Board.
Yes.
Thank you. Yes, good morning, Turks and Caicos, and thank you, Mr. Seymour, as my colleague said, for having us here today to be able to share this platform, and to provide updates and information as it relates to the National Health Insurance Board. My name is Lemuela Forbes. I am the Marketing and Support Officer for the NHIB.
Right. Very good. Well, welcome again to Financially Speaking. And I know National Health has been around, since 2008, 2009, around that time?
Yes.
Yeah. I think we started enjoying the benefits around 2010, I believe.
Yes.
Yeah. I believe that, as I mentioned in the introduction, I believe that the program is very generous. And I want you to share some of the benefits that we get from national insurance. If you could start with some of the benefits.
Okay.
All right.
So I'll let my colleague Judy go on first.
Well, for starters, some of the benefits that you get with us is soon as you're registered, you're able to use the medical facilities. So
It's not 6 months?
No, the on island you use
Also,
that
your Turks and Caicos Island now.
as long as you're registered with us, as long you walk out of the NHIP doors with an NHIP number, you can head on down to any of the local clinics or the hospital, and you just pay your $10 fee at the hospital, and then you pay whatever fee that the actual clinic charges.
Yeah.
And NHIP pays the $35, of course, for the private sector
Yeah.
for you.
Speaking about that, $10, can you imagine going to a hospital? I know that, we're deducting, obviously, from our employees' paycheck, but only paying $10 to get so many different tests that could cost thousands of dollars.
Yeah.
That in itself, to me, is a major benefit.
It is. Because if you really look at the economy right now, if you ought to get sick and you're not covered, what the financial implications you'll be running into? Because we have persons that comes into the NHI with a receipt where their statement can range up to $10,000 to $25,000.
You mean the bill?
Yeah.
Oh, wow.
Yeah. So if you're covered with NHIP, the only bill you see is just the $10. But
Very
if you're
good.
not covered, you actually see the bill because you're charged for everything that happens.
That's a very, very good one. I mean, that in itself is pretty good.
Yeah.
You can't beat that.
No.
You can't beat that.
And when it hurts me as as a human, I'm working for the institution, so most times there's nothing that we can do. But if we put ourselves in a situation where we get everything that we're entitled to, it prevents us from getting a bill such as that, because if you don't know how you're going to pay that bill, that there stays there until you're able to, to clear it out. So it helps us when you go into the NHIP and you make sure you have your accounts up to date. And it's actually you as an employee, you have a right to ask for a statement to ensure that your employers are making contributions on your behalf. Because can you imagine you're working for 10 years and thank God for 10 years you didn't get sick, but you get sick and you go to
Mm-hmm.
the hospital only to be told that
You're not covered.
you're not covered.
Yeah.
So when you get
And
that
that
bill,
happens.
yes, it
Yes.
happens. These are the things that that we have to deal with at the NHI. And yes, we're humans and we have to emphasize with persons and empathize with them, but there are laws and policies that we have to follow.
Yeah, we have to follow the law. Yeah. Tell us some more. I know there are a lot of benefits. Yeah.
Oh yeah, there's right now we do have a TAP program that is fully funded by government, and that you had touched on it
So what is
earlier.
TAP? People watching, what is
The
TAP?
Treatment
Abbreviation.
Abroad program.
Okay.
We refer to it as the TAP program. So if something happens to you and we're not able, the hospital here is not able to facilitate whatever issue that you may have, then there's a referral program that goes into place where you can be flown abroad for further treatment.
Yeah. And how does that work? You go to the hospital. The hospital say we cannot treat you here locally, and then they will send an email to NHIP, and you make the arrangements.
A referral is sent to NHIP,
Mhm.
and after that referral is sent to NHIP, there's a meeting that's held every week that has to go to the board. When they meet, then they would approve or decline on those
Mhm.
referrals
Basis,
that would
yeah.
have been referred to the NHIP.
But what if there's an emergency, and a meeting already took place?
Emergency cases, we have to deal with those right away. Once it's an emergency, that person has to go, then there's no reason for us to get and wait for the
The meeting.
meeting to happen.
Oh,
You know,
okay.
An emergency is an emergency because that's life-threatening.
Mhm.
So once that information comes in, then we, all
Okay.
hands on deck. We make preparations to have that person
Okay.
flown wherever the first person that is able to assist them with whatever illnesses that they may
Right.
have.
And then NHIP decides which facility that patient goes to.
Yes.
The facility will tell us if they're available to assist that person. You got to remember, it's an emergency.
Mhm.
So the first person that says, well, we have the capabilities to assist John Brown with whatever illnesses that would have been shared with the pool, then
Yes.
that's what we do.
Okay. All right.
So
And
we
that-
don't make that decision because we don't know.
So it depends on availability.
Yes.
Yes.
We don't know exactly what's going on with you. The doctors have to say, okay, yes, we can take John Brown, and yes, we can treat John Brown with whatever illnesses that they have.
I got it. So that's another benefit, the treatment
Abroad program.
abroad program. If you
Referred to as TAP.
TAP.
Yes.
So if you cannot get if the treatment is not, if the hospital here cannot do it, then but the referral has to come from the hospital. We
Yes.
cannot go to a private clinic
No,
and get a referral.
hospital.
Yeah. Okay, that's a good benefit as well. Yeah.
If the private clinic has a referral for you, what you do is you take it to the hospital, and then the hospital will take it from there.
Is there a limit on say they send you abroad and it's going to cost $2 million? Is there a limit on what NHIP covers, or they will cover it anyway, no matter what it is?
For Turks and Caicos Islanders, no.
Okay.
Of course, dialogue has to be made.
Yes.
There are communications back and forth with, the hospitals and letting us know where we stand. But for persons on work permit expatriates, there is limits. There are
Okay.
criteria as to how much you are entitled to at what given time of the program.
Okay.
So we have a
that
two-
always was like that.
Yes.
Okay.
It's called the amendment benefit. So you have, I walk with our ordinance as well, so
Oh,
I can
good,
share
good,
share
good.
that information with you.
Mhm.
So we have within 2 years of being into the program, you're entitled to $200,000 within
If you are a work permit holder.
expatriates, not just work permit expatriates. So anyone that has an immigration status with limitations on it, once there's restrictions in terms of it being expired, you're a work permit holder
And so $200,000
within the 2 years. So if you're registered into the system within 2 years of you being registered into the system, you're entitled to 200,000. Within 4 years, 2 years to 4 years, you're entitled to 400. 4 years to 6 years is 600,000. 6 years to 8 years is 800,000, and 8 years to 10 years is 1 million, and the cap at that 1 million.
So anything. So once you've been here for 8 years or more on a work permit or expatriate, whatever, you could get $1 million in benefits.
8 years is up to 800.
8 years up to 800.
10
Okay.
years is up to 1 million.
Oh, okay.
And that is provided that you have continuous payments, continuous contribution into the service. So if there was a break, then of course that break is gonna halt, and then you start where you left off. So if you only contributed for a year and you left the country, say for 10 years and came back, obviously you'll be starting all over again. But if you contributed to the scheme for 6, 7 years or 8 years, then of course we only got contribution for 8 years. So therefore, you can't just go back into the system and start reaping the same benefits again.
So if okay, the client knows this.
Yes.
So if they go abroad, if we send them abroad, and the bill comes to $500,000, and they only entitled to $200,000, they're aware that they have to pay the other $300,000.
The client doesn't see the bill. That's a good benefit there, because once you're off to see the doctor, all of that bill comes to NHIP.
So how do you recover that bill if it's more than what the non-Turks and Caicos Island is entitled to?
The recovery of that bill goes to the insurance policy of it. So the company that covers our payments, all of that goes to them.
So the client really don't pay anything?
No. I think what happens with because we haven't had much of those, once you're getting ready, the hospital would advise us on what's going on, and then we make alternative arrangements with the employers and everyone as to what's going on, so that information, to ensure that we don't reach that level.
I see. Okay, that's interesting. All right.
Yeah. So we have to, we are each other's keeper, our brother's keeper, to ensure that we don't go above what you are entitled to. And there are some cases where we may go above it, but it has to be it's a case where we were aware and approvals would have been granted from wherever necessary from the powers that be, so that we can go ahead.
And it's a good thing you have the reinsurance as well.
Yes.
Okay, that's good. So we talk about the reinsurance. We talk about the treatment abroad. We talk about the $10 you pay locally, and then in the private sector, you fund $35. You say
$35. Yeah.
So if your bill is $50, at the private sector, NHIP pays $35. So we only have to pay that 20. The difference to.
Yes.
Okay.
To the private sector.
Okay.
Yeah.
And also, I want to say that there are also other benefits as well in terms of medication costs. So with the NHIP, medications that cost more than $50, you pay $25. So the $25 is co-paid, and then NHIP pays the rest. For medications that cost less than $50, NHIP goes 50-50 with you. So that's also another benefit as well for persons that are going to be using the pharmacy and getting medications.
So if a medication costs $50, you pay $25 and NHIP $25?
Yes, NHIP covers the rest of what it is.
All right. So if a medication costs, say, $100.
Yes.
So I only pay $25 and NHIP $75?
So if the medication is more than $50, like you were saying, then $25 is copay waived, and then we cover the rest.
All right. So the $100 example.
Yes.
If a medication costs $100,
yes,
I only have to pay $25.
Yes.
And NHIP pays $75.
Yes.
Wow.
When you go to the pharmacy, the thing is, when you go to the pharmacy, you wouldn't even know, because your bill is so low, you don't know what it is.
Right.
The
but in the background.
The background, NHIP is working in the background.
God, this is a lot.
Anytime you go to the pharmacy and you give them your prescription, and they come and tell you your bill is $10.50, and you're
that's the final. That's
just your final, because we paid the difference.
Wow. And I understand that some pharmaceuticals can be very expensive.
Yes,
extremely.
I mean, I heard some cases where it was up to $7,000 for some people, and I couldn't believe it. And NHIP cover it.
Yeah,
basically.
There are some cases where you don't even pay for medication. So someone who's a pensioner, a Turks and Caicos Islander who's a pensioner, they don't pay for any medication once it is covered under the scheme.
They don't pay for any medication.
They don't pay for medical services either. So if you go to the hospital, it's free of charge. So where you and I would pay $10 once you become.
Oh, so a pensioner pay the $10?
No, once you're a Turks and Caicos Islander and you're a pensioner registered with us, you do not pay any fees. It's called a copay waiver.
Yes.
Because you would have contributed to the scheme for so long.
Right. I understand.
Government takes care of its people.
I tell you, this is a generous program.
Generous program,
This is
yeah.
a very generous program.
It's a very generous program. So
Yeah.
I mean, for persons out there who's not aware, or you may have some persons that doesn't believe in the scheme, it is very important that you are covered, because if something happens, that full bill comes to you.
Yeah. And then the rate right now we pay is 6%. It's always been that, right?
Yes.
From inception?
No, I
No.
think it was at 5%
Oh,
once upon
okay.
a time,
Yes.
and then it went to 6%.
All right. And
But
then
the
it's
6% is 3% employee and 3%
3%.
employer.
okay. Okay. All right. All right. Let's go over some more. Share some more benefits with me.
Well, we have a range of categories that you can register under. So you can be self-employed, you can be an employer, you can be an employee, you can be registered as unemployed. Government covers for unemployment.
Oh, but you have to be the Turks and Caicos Island, right?
Yes.
If you're on the work permit, you should be employed.
Yes.
Right.
All right.
So that's for Turks and Caicos Islanders. So within 6 months of you being unemployed, you can register with the Labor Department. That has to approve the form for you, and you bring that registration form to the NHI. Once you bring that registration form to the NHI, you are registered for you can register up to a period of 18 months, but in 3 6-month segments.
So after 6 months, you got to review.
Yes, after 6 months, God forbid, you didn't find anything else to do, but you have to go to see the doctor. You're going to get covered again. So you get an extension for another 6 months. And then you get another extension if within that 1 year you didn't. So you get 3 extensions.
And you don't pay the $10.
You don't pay
at the
anything.
hospital.
Again, it's called a copay waiver. Government pays for that for you because you are unemployed, and that is for on-island treatment. And after that 18 months, if you did not find anything to do, you can now register with us as unemployed, and you pay the contribution at the NHI for $10 children and $25 to the adults. So you pay your contribution, and once you find your job, then of course, we close out the unemployment category and you start under your employers.
Okay. So you got the self-employed.
You have self-employed, employer, employees, unemployment, student registration. We have pensioners.
Yes.
We have ward of states, and we have indigents. Indigents are social welfare covered persons.
Right.
So anyone that is on social welfare, they are covered by government as well. The ward of state are prisoners. We have to ensure that they are taken care of as well. So all of those different categories. And we also have one that is called voluntary. So if you don't fall within any of those categories that I listed, you can register under voluntary contributor. And the voluntary contributor assists persons who would have been granted a status through investment. So, your status doesn't give you the right to work, but it gives you the right to live here in the Turks and Caicos. So if you are living here, you can register as a voluntary contributor, where you pay a contribution of $250 monthly. However, as a voluntary contributor, you are not eligible for the off-island treatment.
Oh, okay.
So it's just for on-island.
But that's still not bad, though.
Yeah.
Not at all.
Compared to what you're going to pay at the hospital, it's still not bad.
Yeah.
Because I've had customers come in tears with the bills that they would have been hit with, but what can we do?
Yeah. Now, when you register because I try registering for a client, right? Because I know at NIB, National Insurance Board, you could register your company, and then you could add your employees. But at NHIP, it's like you cannot register your company unless you register employees.
Yes. Now you got to remember the difference with NIB and NHIP. NIB is more on the pension side, trying to ensure that you secure your pension. So I cannot speak on NIB because that's a different entity, but I can tell you for the NHI, what happens is because there's a medical component that is attached to your benefit. When you register, you're readily available to use the hospital. So when you're registering a business, because you're bringing a business to us, therefore you must have employees. So we can't just have the business just sitting there and we're not collecting any contribution off that business.
I see.
So it goes hand in hand. So once you register your business, even if it's just one person, you bring them in, and then you have the others that follows after you register that person, so that we have something going into the system against what you just brought in.
Okay, at least register one employee, and then you could add. Okay.
The others later.
And but for now, doing everything in office. You're unable to do it online. But coming in the near future, we will have those capabilities available to us with the new system that we are now testing.
Maybe we could do it online as
Yeah.
opposed to physically sitting in the office. Yeah.
Everything the employers will be able to do everything online. So you'll go in, you can register your business, you register your your employees,
good.
and then we at NHI's office, we will view the information that is put in, verify that everything is authentic and is real, and then once we approve it, then it makes the hassle a little bit less on both entity and the persons outside the community.
That'd be very convenient.
Yeah.
Right.
But I will say this, based on what Ms. Dean had said, the benefit with that as well is if the person is coming in to register, where in the past it used to take like 3 to 5 business days before they get registered, before they get an NHIP number. If they walk into the office now, they're actually getting registered today, and they're getting a number today.
Yeah.
So
And a card.
and a card. So
Okay, but there's only certain days for registration, though, right?
that's
No,
correct. Well,
registration is every day.
Oh,
Yes.
registration every day.
However, it's
Yes.
categorized because of the volume of persons coming into the office and the volume of work that they have to do. Sometimes people look at change as if, it shouldn't happen, but changes are inevitable. We are in a growing economy. So imagine you coming into the office with a single registration, right? And you meet Ms. Forbes in the office, and Ms. Forbes has 50 applications to process. So therefore, you have to wait until Ms. Forbes is finished with her 50 applications,
Yeah.
so you can get your one application in when you could have been doing something else.
Yeah.
So what we did as a team, because we recognized the shortness and we recognized there are things that needed to be changed, we played it on we watched how it went. So we just played it out, feel it out to see how it went, where we chose to do Tuesdays and Thursdays for multiple applications, and then Mondays, Wednesdays, and Fridays were for individuals. And it worked.
Okay.
It worked out so well that we actually kept the days that way, because when you come in with your 50 application, we're not inconveniencing someone else who only have one application. So therefore, on Mondays, Wednesdays, and Fridays, when you come in, you take care of your registration. If you need to get a card, you get your card, and then you're on your way. And the persons, like from the corporate world, we look at the resorts and we look at the agencies, because a lot of persons, they have couriers taking care of their businesses. So they will give them all of that information. So to help persons like you and I who are only doing one registration, we put that mechanism in place to help the community to make things smoother. Now, we do take pictures every day from Monday to Friday. We do pictures from 9 to 12:30 for the public. However, if you are registering, you're already in the office registering, we take your picture after the last customer.
Oh, okay. Okay. And how does this work in the other islands? Because I know it's...
Right now, the other islands have to come here because, NHI, Grand Turk has their own office in Grand Turk, so they take care of their business there. Now, for North Caicos, Middle Caicos, South Caicos, for persons who are traveling to Providenciales or to Provo, they can take care of their businesses there. What we are working on is to ensure that we can cover all of the islands. And that is something that we are working on with the management team, so that we can get persons to go and visit the outer islands, where we can take registration forms, assist with payments, assist with assessments, and, help everybody. It's not going to be an everyday thing, but it's going to be more like an agency. I don't know if you recall when the bank used to
I remember.
to South Caicos as an agency on certain. So we're going to introduce that so that our presence can be seen in the outer islands. But that is something that we are currently working on, and making sure we have to make sure we have staff here, because the bulk of the customers are here, and then we have our staff to go over once a month to the outer islands. So we'll have North Caicos being serviced on one day of the month, and South Caicos one day of the month. Now, for North Caicos, it would be for both middle and north, because persons can drive over.
You could just...
So we are in communications with powers that be, so that we can have those things sorted out.
That'd be good. That'd be good. I want to go over the thresh line. So for an employee, it's 7,800, right?
Yes.
yes, that's the cap.
So if you're making 7,800 or less, that's the cap. So you're making 10,000. You pay on 7,800.
800, yes.
Now, for self-employed, do you know what it is for
It's the same
self-employed?
thing. It's the same cap, straight across.
Not 7,000.
7,000.
For self-employed people?
You pay $250 monthly for self-employment.
Mhm.
That's the cap there, the highest you can pay.
Yes.
Now, if for some reason you're unable to pay the $250, then you would meet with one of the compliance officers or the manager so that they can give you a lesser rate. Now, in doing so, there are certain things that they will ask you.
Right.
And once you provide that information to them, then they will give you one of the lesser rates
All right.
so that you're not paying the $250 to ensure that you're able to accommodate.
Right.
All right. So $250 a month.
Yes. That is straight across, start off.
Even if you bring your records and you're making a lot more money.
Yes, because you're self-employed, because it's $250 max. Now, until the ordinance changes and government decide, okay, for self-employment, we need to collect more, then that's what it would be. I believe NIB's self-employment is more now, and we're supposed to be combining so that we're charging the same amount that NIB charges.
Oh, okay.
That is something that is in the works right now as well.
So they got to change the legislation.
Yes.
For that.
Now, I'd also speak to what she said. The ordinance does have different categories or different brackets that a self-employed person can be put in, but that is with the discretion of the compliance officer or with the compliance manager. So like she said, there will be like financial records and other documentations that, you know, you would have to provide us with in order for us to say, okay, well, you qualify to be in this particular bracket. You don't qualify to be in this one, that one. So there are different brackets, but the highest is 250.
Okay.
Yeah.
Now, in terms of the benefits, not the benefits, in terms of the coverage, there are some areas that there's some illnesses, right, or that NHIP does not cover, right, or they basically cover everything.
The only thing I'm aware of is dental and, correct me if I'm wrong, dental and
like fertility treatments,
Yeah.
lifestyle, sex change, those kind of stuff, like cosmetics.
Cosmetics, yeah. We don't cover those.
All right, so basically we cover almost everything except a few things.
Yes.
Right.
And that is on our website as well.
Yes.
with
Oh,
what
you
we-
have a list of
Yes.
Yes, we do.
okay.
All of those are listed on our website as well.
So if a person is not quite sure, they can always visit our website. We have a list of it there.
Oh, okay.
Yeah.
Okay. Well, give us some more information.
Well, basically, I would say this. There are some misconceptions about NHIP and different areas, whereas there's a misconception where people believe that everybody pays $50 when that is not the case. So
$50.
yes, you have some people in the community that believes that, okay, my contribution is only $50. Your contributions are based on it's based on your salary. So if you're making $1,000 a month, for example, your contribution payment is not going to be $50.
Right, it should be 3%.
Exactly. So we just need persons to understand that, because
I never knew that. I never knew people was thinking
you would be surprised to know.
that. Okay.
I think what happens is we've been guided by best practices in some cases, and persons where they might have been already comfortable. Because if Judge, you coming in the office and I said to you, well, you pay $50. You paid $50, say, for 3 months. And then when you come into the office, you see another officer. Then that officer tells you, okay, well, your bill is now $72.85. You want to know how come your bill is now $72.85 when you were always paying $50. So again, is a lot of, what had happened before and what we are trying to, make sure that we are doing things ordinance-based. So if your employment contract say you make so much money, say for minimum salary is $1,408. So you will pay on that, which is $84.84. So a lot of persons would be in our system at that cap. Now, persons working in hotels, of course, even if you are making $8 an hour, of course, we know of gratuity and all of those things
Service
that
charge.
is paid
Yep.
at the end of the month. So all of that is calculated into what you're paying. So you pay NHIP on everything
Ah.
except your bonus.
Oh, except bonuses.
Yes,
I
the
think
ordinance speak to those things. And again, if you're not familiar with the
up
ordinance,
to the
it's
threshold, of
on
course. Yeah.
it's on our the ordinance is on our website. So if you have any queries or anything that you would like to, clarify, and you're not satisfied with what you got from, this talk show or anybody else who said something to you, you can always go onto our website and look for the ordinance, and you can view it into its entirety so that you can get a better understanding. It is for public use, so it's not just for NHI's
Sure.
staff. So it is for everyone to use.
So we want to get back to this. So is the you're paying the NHIP on your total compensation except for
Yes.
bonuses.
Yes. Your overtime, everything that your employer is paying you on, as long as it hasn't exceeded the 7,800,
Right.
you
The
pay
cap.
NHIP the
Oh, I wonder
6%,
people
which
are
is
really doing
3%,
that.
3%. Now, that is a good question, because that is why we now have compliance officers making field visits.
So the
Yes.
people come to people's businesses?
Yeah, we have our staff going to people's
Yes.
offices, and we just show up. We have the right to do that.
Unannounced?
Yes, we do have the
Yes,
right to
the
do
law
that,
does
and the law
allow us to
provides
do
us
that.
for it. Yeah.
Mhm.
And we can ask you for your bookkeeping, and we make sure whatever that you have been submitting to the NHI is what should have been submitted to the NHI.
And let me say this, the field visits are very important, and it's not to scare anyone, but it's to ensure that, you are following the right process of what is required of you as an employed person that has staff, and, to make sure that you have all of your records and everything in place. So we're not just there to, beat it down your throat. We're not there for that, but we're there to make sure that, you are following the correct procedures and what is required of you as an employer. So that in the event, if there is an issue while our officers are there, that is the opportunity that you can ask questions if there's something that you don't understand. So those field visits are very essential, because there might be persons that, don't understand, but then don't have the time to come to the office. So, it's essential for those purposes. And you can also ask a question. And I would also say this as well, what we were talking about with the contributions. There are persons that believe that because they have multiple employments, that they don't need to pay contributions from those employments. You have to pay contributions from all of those
As long as
employments.
it does not, as long as
Exceed.
It does
Yes.
not
your
exceed the cap.
compensation does not exceed.
Right.
Yes. I was,
Well, they should. But
Yeah.
the working with those ain't supposed to have multiple employers.
but
right?
then, again,
but
this
if
is
you're
the
touching
world.
only you can, but
Yeah, this is the world we live in. We know persons have 3 and 4 jobs. So if you are working for 3 and 4 employers, then all 3 and 4 employers need to be making
They should.
contributions for
They
you.
should.
they should.
So therefore, you should come into the office. If you're working for John Doe and Company, Kickstone and Company, you should be registered under all of those companies so that contributions can be made on your behalf.
Okay,
That is one of the biggest misconceptions we have, because we have persons coming in, but you would have the employer saying, well, I have John Brown working for me, but he says he's working for Mr. Seymour. I don't need to pay his NHIP or his NIB. And therefore, you're paying them their full salary, which should not be the case. If you are working for more than one employers need to make the contribution on your behalf.
I mean, it makes sense, especially if you haven't reached that threshold, of the 7,800. Now, what is the penalty when, for those employers who do not pay? I know it used to be 10%, but they changed it, right? It's not 10% per month anymore, right? Is it 3%? How much is it? The penalty
In terms of penalties?
Yeah.
Well, they accumulate over a period of time.
And what is the rate?
So it's
3%.
3%,
Right.
like Judy was saying. And then over a period of time,
compound.
it's compounded. Yes,
Right.
that's the word.
Yeah. Okay. That's very important too. I mean,
Yes.
some people, and then some people, they don't pay. I rather pay on time than to pay late, because you're not paying that interest, the
Yeah.
penalty.
It's a funny thing you say that, because you can, as a self-employed person, you can actually pay in advance as well. Or
Really?
or persons who
How far?
3 months.
3 months.
Yeah. I mean, it's at the discretion of the head of the department as well. So, for instance, if you're someone that doesn't really have time, you can come in and then we can make an agreement just to ensure that we are reaching to you where we can. So, because it's a two-way street. It's not always okay. I can only come in once a month, or I can come in however it is. Then we work that out with you, so you don't have to come in every month to say join the line and make the payments. And of course, we do have our e-services portal where you can sign on and do everything at your leisure in terms of payment.
Yeah.
And I would also like to talk about another misconception while we're here, and I know a lot of people are listening in, where with some employers, they have multiple employees on their account, and they feel like, okay, I'm only supposed to pay for one person, and the others would pay for themselves. With NHI, it's not that way. Perhaps NIB would allow that, I'm told, but with us, our system is completely different. So the onus is on the employer to make sure that he or she is paying for all of their employees. So it can't be separated where a person says, okay, I only want to pay for Mary and John Brown, but the other rest you're not paying for. You have to pay
You have
for
employees
everyone.
who do things like that?
Yes.
They
Really?
would come in,
Yes.
all day. And then you would have person coming into the compliance department. I just want a single bill. And you have 10 persons registered under Jane Brown and Company. But you have an employee, not the employer. One person coming in that they want their bill so that they can pay their bill and think that everything would be settled. But it is the actual employer's account that needs to be.
So an individual cannot come in.
We have been accommodating persons, but because if you really look at it, NHIP has a contract with the employer.
Yes.
So it's not a contract with the employee. So most times when persons come in, you would have, we would tell them, go and get your boss, or, whatever the case may be, so that we can settle whatever needs to be settled. But we do have persons coming in asking for their bill on their own, and they will give you any fictitious amount to say, well, this is what I'm being paid, so that, they can get a lesser rate, but that's not how it should be. Yeah, those are the things that we have.
Right.
We're faced with on a daily basis in the office.
And I think Ms. Dean can also speak to when it comes to the situation of change request form, because you do have employers as well on that same subject, whereas if somebody stopped working for them, they don't come in to say to the NHI, okay, this person is no longer working for me, and but you
can
never
do that
came.
online, right?
Yes.
Yeah, there's a change request.
You can do it online. However, it's for the current month.
Yeah.
So if Jane Brown resigned in January and you sign on the portal in February, you cannot terminate Jane Brown in January.
Yeah, do it in February.
You'll have to do it in February.
I noticed that. So to avoid that, we have to come in person then.
No, you can fill out the change request form in the termination section and say when that person was terminated, so that we can terminate them out of the system for you. Now, what happens is, like Ms. Forbes mentioned, we have persons not working for companies anymore, moved on, or not even working at all. But the fact that they are open, they're able to use the medical services.
Because they haven't been terminated.
Haven't been
Exactly.
terminated. So that causes a problem, because when you finally come in to terminate Jane Brown already used the hospital for 3 or 4 months. So now you have
But there's nothing you do. NHA can't do anything about that.
There's nothing we can do about that, but then you are now going to be penalized because you have to pay the contributions because they use the medical services. So it is important.
As far as you're concerned, they're still employed.
They're still employed because you didn't terminate them. We didn't receive anything to say that Jane Brown no longer works with us. So it is very important for you to fill out that form, sign it. So it's not just you sending an email to say, terminate Jane Brown from Jane Brown and Company. You need to ensure that that is signed, because we need to have the proper authorization. Because if something happens, we don't have the proper authorization, then NHIP is liable.
That's true.
So we need to ensure that everything that we do, all of our instruments that is out there, it has to be signed by the authorized personnel when we are executing business on your behalf.
That is true. You could share some more.
One of the other misconception we have is with civil servants.
Oh.
Yes, civil servants, are working or they became employed with government, they're not registered into our system. They are thinking that they are covered because they're working with government. Of course, government is going to take out their contributions to make sure, they adhere to the laws and regulations of the NHI, make sure they submit your contributions. Your contributions will now have to be suspended into account until you're registered. It's not that your contribution wasn't made. It's just
So
that
even though money is being paid to NH for you, but it's in a suspended account because you have not been registered. But the employee is thinking that they're registered.
Yes. So what I want for the listening community to understand is if you're working for government, you're a civil servant, once you complete your form, please pay attention to your email because that's what they do. They send that form back to you and then you have to bring that into the office so that you can get your registration done. We've had instances where persons would have been working for 6 years, 7 years, and only when going to the hospital will tell them that you're not covered.
Yeah, that is true. I know that for a fact. I know that.
I'm a government employee, and my monies is coming out, and all of those things. So those are some of the things that
even
we
the
are
private
faced
sector.
with.
Some people,
They just think
some
that
people are taking money from the employees and they're not.
yes,
And
again, like I mentioned earlier on in the show, it is your right. You can come in and ask. You don't have to wait until something happens.
That's
you
right.
can call in. You can ask, is my contribution up to date? I mean, of course, we're going to verify that is you that is calling. And, then we can say, yes, your contribution is up to date, or no, your contribution is not up to date. Then you can go to your employers. Hey, I just spoke to NHIP and this is my concern. But again, like I say, it is your right as an employee to ensure that your employers are making contributions on your behalf.
Absolutely. And that's very critical. Like, that happened to my daughter. She works for government. And she went to the private clinic and she was not, we thought she was registered. So we had to go and get all the paperwork done,
I remember that case.
Yeah, so you're absolutely right.
It's not just your daughter. We have others that falls into that same category as well. So just to ensure that the listening body out there knows that not because you started working that you are automatically covered.
I think that's the problem.
As long as you are changing a job, you have to register under the new employment. You left one, you go to another one, or you're still with that one and have another one, you have to come in and do your registration.
And that also goes for their dependents as well.
Yes.
Because some people believe that, okay, because I'm registered now with a new employer, that means that my dependent automatically comes over. And that is that.
Yes, that is something.
But the employer must, not the employee though, right? The employer must register.
The employer will sign the forms because, like I said before, you have persons coming in to bring their registration forms. So once the employer signs that registration form, it is authorized by the employer. We are bound to take it and action that on their behalf. Like Ms. Forbes mentioned, we have persons, the first time they registered, they would have registered their dependents.
Right.
However, they left Scotiabank and started working with First Caribbean. Now, First Caribbean has them registered. However, their dependents weren't registered. And then something happens. You go to the hospital and the dependent isn't covered. And then you will call and say, oh, but I registered. Yeah, you registered, but you didn't register your dependents. Now, we wouldn't know that you have dependents that you want to register. So the onus is on you to ensure that whoever you covered before, as long as you are still covering them, wherever you are moving from, you are still keeping them covered.
Yeah.
Now, another thing that I want persons to understand as well, you cannot be covered for dependents under 2 jobs. So if you're working 2 jobs.
Oh, okay. So only once.
Yes.
Okay.
Right.
One person will pay for the dependent.
Okay.
So if you're working.
It's only $10, right?
Yes. $10 for children and $25 for adults. And of course, we cover grandparents, parents, and children.
Oh, you type of grandparent. Okay.
Yes. We
I guess if you're dependent, and that's your dependent.
Right.
Yeah.
Now, one of the misconceptions that we have as well is for the elderly. If you are an elderly, a Turks and Caicos Island elderly who was not eligible to receive pension from the NIB, because that there constitutes you as a pensioner with the NHI.
Right.
If you were not eligible, you would have been given a grant. Therefore, you cannot register with us as a pensioner.
What do you mean given a grant? What do you mean?
NIB.
Oh,
So if you're not eligible to become a pensioner where you receive the monthly pension, They would give you a grant to say that you got $3,000, $2,000 or whatever it may be, but you're not receiving a monthly pension. The ordinance does have provision where we can register you in our system as a pensioner. However, you have to pay 6 months contribution of $250 upfront, and then you pay for an additional 6 months. So you have to be registered in our system for a year where you make your $250 contribution in
Before
our
it kicks
system
in.
before it kicks in as a pensioner for you.
All right. So
At least you'll be covered for medical care,
Right.
but you'll still have to pay into the scheme until that year is up
All right.
before you can become.
so while they're paying, they're not eligible.
Yes, you are. That's why I said in order for you to become eligible,
Uh-huh,
you're
you-
paying 6 months up front.
Oh, so you pay the 6 months
Yes,
up. Okay.
that's-
Okay.
that's
so
what the
okay,
ordinance-
you pay the 6.
That's why I work with the ordinance
I'm
to
glad you brought it
ensure.
because I refer someone to you, I believe.
Yes, and I helped. She came in.
She's
yes.
registered?
Yes, she did. She
Okay,
came in
that's very
yesterday,
good.
so
Yeah.
she.
I think that's a similar case.
Yes, she did call in, and she explained to me her situation, and the best category for her to fit in was
The pensioner
yes,
will pay the 6
but
months
she has to
up
pay
front.
the 6 months.
Oh, that's
up front.
good to know.
Now, if you doesn't pay that 6 months up front, then you won't be eligible to use the medical services on island because you haven't paid us what is due to us based on the ordinance.
Mm-hmm.
So it is important that
So there are options. Then.
there are
Yeah,
options.
yeah,
There are options. Like I say, even if you weren't able to register under that particular category, there is one that's called volunteer,
Right.
the voluntary one.
But that's the investment one, though, right?
No, Turks and Caicos Islanders can register under that as well,
Oh, okay.
provided that they do not fall under any of the
other.
other
All
categories.
right. Okay. Okay.
And the ordinance clearly stated out for us, if you do not fall under any of the other categories, then voluntary contributor
Which is $250.
Yes,
Similar to the.
similar to
the
the
self-employed.
self-employment.
Right.
However, with the voluntary contributor, you are
That's good
not
to know.
eligible for off-island care.
Okay.
And that is on the form and everything. So
Yeah,
once
but I
you
mean,
sign that,
it's still better than not having anything
at all.
You know,
Yes.
and hopefully the hospital will be upgraded soon and we can get a lot of stuff done here locally. I mean, anyway.
Yes.
So all of the private facilities that are here, we could go there. I mean, we could go there. The private facility, do they have to register with NHIP?
They register with us so that the discount can be applied to
All
you, the
right.
$35.
So once they register, we go there, it'll be applied.
Yes.
So as far as you know, there are no private that's excluded.
No,
No.
not
Yeah.
that we know of.
Not that
But
we know of.
once you coming on board, what they do is they meet with the relevant parties at the NHI. They have all of that ironed out,
Yes.
put into the system so that when they do open their doors or shortly after they open their doors, if you go in as a patient, all of that is fixed for you. You don't know anything that's going on in the background.
Right,
All you know is
Exactly.
you go to see the doctor, the practitioner sees you,
Right.
and then when you're finished, you get your bill, you pay your bill, and then you leave.
That's good.
Yeah.
That's good.
Let me say that there's a lot of great benefits about the National Health Insurance Board.
It's a lot.
It is a lot. Let's take, for example, okay, you have an emergency, you go into the emergency department, and the person who's at the registration desk says, okay, $10. Imagine if you do not have coverage.
Mm-hmm.
So you're paying to register, and if the doctor has to see you, and if there's other care that has to be done to you,
That's an additional fee.
that's an additional fee. Take, for example, when they send you to take x-rays, I believe that is like $250 or $450. I saw
and
someone
depending
was
on the type. too,
Depending, yeah.
exactly.
What
So
it
there's
is.
a lot of great benefits because imagine if you had to travel overseas for further medical care. You don't know what that bill looks like.
No.
We know what the bill looks like, but you don't know what the bill looks like. And plus, we're paying for that, and we're also doing your ticket arrangements. So you're basically not
Yeah, and then
paying
if the
for
doctor say you need someone to travel with you, you make that
exactly,
arrangement as
pay
well,
for
right?
that.
exactly,
person,
and
and
that
you-
person is not paying for their ticket as
No,
well.
and then you give like some per diem or something.
Yes. So there's a lot of great stuff about NHIP, and we want people to know that we're not here to take your money, but we're here to make sure that you are getting access to good quality and affordable health care,
Yeah.
because that's what we're here for.
Yeah. I mean, tell you the truth, I think NHIP is paying us more than they're receiving.
Yes, they do. And like Ms. Forbes say, when we are sending you out, you don't see a bill.
Exactly.
I can attest to that because I was indirectly a recipient of being one of the patients that went to overseas for treatment, my daughter had to use the program. Yeah, my daughter used the program. And this was prior to me working at NHI.
Oh, okay.
I think that's one of the reasons I actually wanted to join the NHI, because when I came back, I didn't have to go in my pocket and do anything. So while I was off, yes, I had to go in my pocket and pay our rent and whatever the case may be, but all of that was reimbursed because, you know, I took a minor to see the doctor. We were out there 3 days shy of a month.
Oh, wow.
So
that's a long time.
Yes, which is a long time. And when I left the doctor's office and we got a clean bill to travel, I didn't get any invoice. All I got was, thank you, Ms. Dean, you can now travel with your daughter. So those are the things that, you know, if I had to go in my pocket for 27 days, paying for rent, paying for food, paying for medical services, and especially what she went and do, I'd probably still be on a payment plan.
I don't even know if the private insurance pays for your ticket. I may be wrong. I'm not even aware. Like people who have private insurance, whether they assist you with accommodation and
the difference is with the private insurance and the NHIP is the private insurance has a deductible. That deductible has to come off straight off the top, and there's a cap also.
There is.
Whether you're a Turks and Caicos Islander, you're an expatriate, whatever, there is a cap.
Doesn't matter your nationality.
And with private insurance, I can guarantee you when you reach that cap,
that's it.
Your money have to start talking. So if you ain't have no money, your treatment can abruptly stop.
Yeah.
So when you sit down and you think about, oh, NHIP doesn't benefit me, or I prefer this or prefer the other, if you really look at it, NHIP does benefit you.
And if you want private insurance, you get it.
It's your choice. Yeah, it's your choice.
We don't a good system here.
Yeah.
Now there's a lot of myth that that NHIP owes overseas suppliers so much money that they're not sending people abroad. Is that true?
Not that we know of.
Yeah.
No. Like you say, it's a myth.
Yeah.
I mean, with every organization, there are persons who are, not satisfied, or persons who wouldn't want to say exactly what happens. Because when someone come to you and they start talking, there's 2 ways. There's 3 sides to every story.
Yes.
The truth, your side, and my side. Obviously, so we all will fall into that category once in our lives. You understand? So. Because you are disgruntled about whatever happened, you would want to speak everything that is ill of that, thing that happened. But we do have persons that comes in and their testimonies are life-saving.
Yes.
And they have positive experiences. Not everyone would have the same experience. And everyone that we have persons that come in, they are grateful.
Yeah.
They are thankful. Yeah. Because things could have taken a different turn. Yeah. And again, like I say, I know I'm grateful and I'm thankful because my daughter was a recipient of that program, and she is a fine young lady now. And she was 3 or 4 when that happened. So it's been 5 years, and everything is in order for her. So
very good. That's good to hear. And also, I think what we need to do too, Judy and Lamuela, is to stress to the public, because sometimes NHIP get blamed for a lot of stuff. Yes. NHIP is just the middle person. It's the middleman, so to speak. NHIP doesn't want you to be sick.
No.
Okay. Sometimes it's us. We don't do our checkups on a regular basis. We need to do our checkup on a regular basis. You go to the hospital. The hospital say, "Listen, I cannot take this case. I have to send you abroad." They refer you to NHIP. NHIP make their insurance. So sometimes we blame NHIP. NHIP cannot send you abroad unless the hospital recommends that. You're just a middleman, so to speak.
That's correct.
And I think that's very important that we stress that.
Yes.
And also,
we have persons walking out of the doctor's office and calling NHIP. You get my referral.
Yeah, that process doesn't work that way.
You just left the doctor's. Yeah, I just walk out the doctor's office and the doctor.
Oh, so the doctor's home they refer you, but they expect you to get it right away.
Oh, my doctor said they send you my referral.
I understand.
No, it doesn't work that way. You just walk out of the. Chances are, when you walked out, another patient was walking in. the doctor haven't sent that referral as yet. We cannot do anything unless the referral is in our office. And then, of course, like I mentioned before, there's weekly meetings
Yes,
with
JRC.
the JRCs with the meetings. And then once that meeting happened, then we know what is approved, what is denied. Of course, the hospital would be aware of what was approved and what was denied. Now, that is one of the cases that they will never speak of. The hospital will call you and advise you of, what is going to happen. But again, it's easier to blame NHIP.
Yeah.
We're not.
And actually get blamed for a lot of stuff. They really do.
Because it's easier. It's easier to say the NHIP ain't do this, NHIP ain't do the other. But,
and we want people to understand that we are really compassionate about what we do. And it's not that, we are not concerned. We are very much concerned because we do know that once people's health are at stake, we know that tempers flare. We know that people start to, get a little edgy, and we understand that, and that's the human side of all of us, because once it's our health care, we know that, okay, there's an alarm that goes off in your head. So right away, you want this, that, and that to happen. So, we want people to understand that we understand. And it's not the fact that we are dragging our feet and we don't want to do it, but we need our customers to understand that it has to go through a process.
Yeah.
And once it goes through that process, then, we take it from there.
Yeah.
And like she said, there's a lot of people that believe that, okay, I just got out of my doctor's office and the referral has been sent to NHIP. It doesn't work that way. It goes through the Joint Referral Committee every Wednesday. That meeting is held every single Wednesday so that, they can come together and discuss all of the referrals.
Right.
So that has to go through that process as well. We don't just take it up and say, okay, we're sending you this way, that way. And if that be the case, we have to get all of your medical records and everything, a history of everything, so that we're not sending the incorrect information to our providers overseas, because then that will become a problem. So all of these things, there's a process that happens before, things get done the right way. And that is why it is the way that it is. But, we don't want people to feel like, we're just dragging our feet and that we don't care. We very much care.
Yeah.
We do care. And that is why there's a lot of things that are happening in the background so that we make sure that what we are doing, that we're always efficient.
There's a seamless process.
Exactly. So we are not a perfect organization. I will say that. There is no perfect organization. But, every single day, we look at our processes, we look at, what we can do today, what we did today that we can do better tomorrow. So there's a lot of things that people may not see in the public's eye, but in the background, there's a lot of different things that are being orchestrated. There are a lot of different processes that are changing, and that is all for us to come together and to better serve you as the public.
Yeah.
And to piggyback on what she said is, we have a lot of customers in our system that does not have updated IDs.
That's probably one of them. Okay.
That is one of our issues and concern as well, because where we have an emergency, like you say, we get an emergency referral. If the ID in our system was up to date, then we can go right ahead and make the necessary arrangements. But if the ID is not up to date, then we now have to try to reach out to the person's next of kin. Can you get this for me? Can you get that for me? And most times they don't even have a passport.
Yeah.
So we now have to.
So your system is not yet where the ID expires, you get a red flag?
No, it's not there as yet. But then again, when you register, we ensure that you're knowledgeable of this. So when your ID expires, bring it to us. If you change your passport, bring it to us. Because, things happen. You can change your nationality. You become naturalized and you now have a TI passport. Bring that information to us. Because if you're not bringing this information to us, we don't know.
So every time you get an updated ID, also share it with
us, because it helps you in the event something happens.
Yeah.
And one of the things that we need to understand as well, too, is work permit holders.
Yes.
Your medical closes at your expiration date. So if your work permit expires in March, therefore in April, when you go to the hospital, you won't be able to use it. So you need to bring us your receipt, or you need to bring us the new work permit so that we can update your medical to ensure that you have a seamless transition from your old work permit to your new work permit.
Yeah, speaking about work permit, because for work permits, because we continue to pay
Mm-hmm.
into the NHIP system
Yes. Mm-hmm.
despite their work permit expired.
Mm-hmm.
And so when they go for services, they don't get it, even though we paid.
Now that is because the employer or the employee didn't bring us their updated information.
So when you get a renewed work permit, just like any ID,
Mm-hmm.
we have to bring it into you.
Yes, so that we can
Otherwise, that service, even though we're paying into it, that services could be discontinued.
Discontinued, yes, until you bring it. And then what we do is we assist you by taking in your receipts as well.
Yes.
So while you're in the process of waiting for that actual work permit, because we know we're not in a perfect world,
and sometimes work
things
permits take
happen.
long
Yes.
to
So
get.
what we do is we update your medical if you bring us that receipt. And you write a letter, you being the employer, you write a letter advising us that you are responsible for Jane Brown. Jane Brown work permit expired, however, is in the process of being renewed. We update that for you. But if you don't bring it to us, then we have nothing to update it with, because to
as far as you're concerned,
you're illegal. Yes.
Yeah. Anyway, our time is up. Do you have any closing remarks? Because our time is up. You would like to share maybe something that we didn't cover or say?
Well, what I want to say to the listening community is NHIP is here to help you.
Yes.
We're not here to lambaste you. We're not here to make anybody feel inferior. We're here for everyone. So we're just here trying to offer a better service. So we want you to help us. Come on in, ask whatever questions you may have, and anything that you're not understanding, you can ask so that we can better clarify it for you.
Yep.
You have anything?
And all I want to say is, for the listeners out there, to look out on our Facebook page. We will have some testimonials that will be coming up
good.
In relation to our TAP program, because there's a lot of misconceptions about the different places that we send persons. So I just want to tell, everyone out there to look out for that. There will be persons that will talk about their different experiences and the different places that we have sent them. So
good.
we're working. We're working, and we're here for you. We care for you. We understand. And we are doing the best that we can so that we can better serve you.
Great. We've been watching Financial Speaking, and our guests with Judy and Lamuela from the National Health Insurance. I hope this show was very informative. And I want to encourage us, sometimes we complain so much about the organization, we complain so much about our country. And I want us to step back sometimes and just think about the benefits. $10 to go to the hospital, treatment abroad program, pharmaceuticals, anything over $50 that's being covered by NHIP. You go to a private medical facility, they pay $35. There are so many benefits. They cover basically almost every illnesses that you have, except a few, exceptions. But I think the NHIP is a very, very generous program, and I think we should be grateful. Of course, we need improvements in anything we do, not just NHIP, in any organization, in our lives. So please, let's be thankful and learn more about NHIP. Make sure that you are up to date. Make sure your company has registered you. Make sure, even though they may be deducting money from your paycheck, that doesn't mean that you're registered. So make sure you do that. So thank you for watching the Financially Speaking Show. See you next Tuesday, same time, 11 a.m.